Michelle Jack and I'm Associate Professor of Clinical Practice in the Medicine Program here at Bond University on the Gold Coast. I'm also a Senior Staff Specialist and Paediatric Endocrinologist in the Northern New South Wales Local Health District. I graduated from the University of Queensland and undertook a scholarship and fellowship with the International Juvenile Diabetes Foundation to complete my paediatric training and a PhD in beta cell biology and hyperinsulinism. I then worked as a paediatric endocrinologist in Brisbane and then in Sydney for many years at the Royal North Shore Hospital, and was involved in research again in clinical trials to try and prevent type 1 diabetes. And then more recently have been involved with collaborators from the University of Sydney and the New South Wales Newborn Screening Unit in the areas of thyroid disease, and particularly in newborns and infants. I moved to Northern New South Wales and initially at the University Centre for Rural Health in Lismore for about 18 months, and I really enjoyed that work as Academic Lead of Education and Partnerships for UCRH. And more recently, in January, I started working at Bond University, where I'm involved in leadership and training in the medical program here at Bond at the Gold Coast. There are three main areas of research that I've been involved in, and that's congenital hypothyroidism, so looking at newborn screening of infants and newborns with congenital hypothyroidism, and particularly those with borderline thyroid abnormalities. So I've been involved in a number of collaborations with the New South Wales Newborn Screening Unit and staff at the Charles Perkins Research Institute with the University of Sydney. I'm also collaborating with researchers at the Children's Hospital at Westmead looking at abnormalities in thyroid function in newborns and infants there. The other area of research that I'm involved in is in First Nations health, so I'm involved on a number of MRFF grants that are funding looking at the social and emotional wellbeing of First Nations children in Australia. The last area is in the areas of family-friendly workplace policies and looking at the impact of that on the health and well-being of children. And then obviously at Bond I'm very interested in medical education, and I've been looking at how to improve the outcomes for our medical students in terms of their learning and well-being outcomes. I grew up west of Brisbane, so on a farm, and I was first in family to go to university. I come from a family that wasn't particularly affluent, but really developed a love for rural medicine then. I've also experienced quite a few health challenges, and during that time I was able to experiment outside of health. About 10 years ago I was involved in refugee advocacy work, and then more recently in First Nations health. So I've always wanted to make a meaningful difference, particularly in priority populations, and I'm really hoping that I can bring that passion now to Bond, to the work that I'm doing here as well with medical students. I really enjoy living so close to the beach. We go for a walk every morning on the beach, have a gorgeous little toy cavoodle called Teddy that comes along with us. We swim, we walk, we cycle, and it's a really great lifestyle. Family is really important. My family are in Brisbane and in Sydney, but we've moved up to be closer to our family in Brisbane, so it's been really lovely.